White House yesterday advised pregnant women to avoid taking Tylenol, linking the over-the-counter pill to rising autism rates in children.
Yeah, but the evidence behind that link is being called into question by the medical community. Some argue that better awareness around the disorder is what's behind the spike in diagnosis. It's not pills or vaccines. We're joined by Professor Helen Tager-Flusberg, Director of the Center for Autism Research Excellence at Boston University. Doctor, thank you so much for being with us this morning. I first want to ask about your reaction to what the president had to say, and he was very much definitive, saying, if you're pregnant, do not take Tylenol. Your reaction to that?
So I think, as you pointed out earlier, we were expecting an announcement of this sort, but I was completely shocked and distraught at listening to the extreme way in which this was presented yesterday. The evidence is really small. We don't think in any sense that Tylenol causes autism, and it certainly can't be related to the spike in case of it's not a spike, it's a gradual over time increase in cases of autism. This cannot be, because in fact we know that Tylenol use by pregnant women has already gone down over the years based on advice from the American College of Obstetrics and Gynecology.
So now there's going to be a label change on Tylenol, and according to medical professionals like yourself, there's been no definitive study linking it. What is your reaction to that move?
I think it's an extremist move. I think it has the potential of having terrible repercussions on the health of pregnant women, and potentially an impact on their fetus. Because one thing we do know is that fever in pregnant women, infection in pregnant women, these are risks that are associated with different developmental outcomes for their children. And that's why the advice is always treat the fever, treat the infection, and Tylenol is indeed the medication of choice to do so. Women may turn to other alternatives which don't have labels on them saying this, and those alternatives are worse than the Tylenol. So it's devastating, I think.
Doctor, how has the research into what causes autism or potential causes of autism evolved over decades that it's been studied?
Okay, it has certainly evolved, but already in the 1970s, very early evidence suggested that there was a strong relationship to genetics. And over the last several decades, we've learned more and more about how important genetics are in explaining the causes of autism. The story is complex. It's not that there's some single gene or just a handful of genes. We know it's complex. It involves hundreds of genes, but this is the primary cause of autism. And what we know about environmental risk factors that may be associated, perhaps in more significant ways than Tylenol, like air pollution or pesticides, is that these interact with the genetic predisposition for autism.
So of course, the administration isn't just talking about Tylenol with links to autism. It also is still talking about vaccines and links to autism. As someone in the medical community, what do you think about people refusing to vaccinate their children or delaying, let's say, a Hep B vaccine for their child when there are consequences, or could be consequences?
Well, if the message coming out from the President of the United States and the Secretary of Health and Human Services, who's been saying this message of vaccines cause autism for more than 20 years now, if people hear this, yes, they are going to be concerned. But there has been more research on this topic in my field than any other. And every single gold standard study looking for links between vaccines or products in vaccines and autism has shown that there is no such link. Parents are far better off vaccinating their children than not vaccinating their children. And they should follow the guidelines of the American Academy of Pediatrics and listen to the physicians who have the expertise rather than the heads of our administration, none of whom are doctors with expertise in this area.
Doctor, what, if anything, concerns you about this move moving forward as it relates to how pregnant women are treated by their doctors and also the research that you do?
Well, on the research front, I actually am fairly optimistic because at the same time, as we've seen President Trump and Secretary Kennedy tout unscientific links to the causes of autism. The NIH launched an autism data science initiative, and yesterday they also announced who was going to receive these awards and what the nature of those studies was going to be. And they look very comprehensive, very promising, many of them looking at exactly what I was saying. We need to think about environmental exposures and how they're linked to a genetic predisposition. So I think on the science front itself, we could be optimistic. And that's where we should be focusing, because none of what we heard yesterday at that press conference is rooted in anything like a credible science.
We have less than a minute left, so I hate to do this to you, but leucovorin, there seems to be some research, limited, small studies, but they're suggesting this could help treat some symptoms of autism. Can you break that down for us quickly?
Yes, those studies are promising, small-scale, preliminary study, but we've seen this repeatedly in autism. And when they go to a large-scale randomized controlled trial, many of these promising treatments do not pan out. Before recommending this, the FDA is being completely irresponsible by telling parents that they should be treating their child with leucovorin. And the really awful part of this story is that a lot of the movement behind pushing leucovorin is coming from people who have companies that manufacture leucovorin, are coming out with books in favor of this. So talk about a conflict of interest. This is exactly what this administration promised us they wouldn't do. And in this case, this is where they are heading. And it is simply unconscionable in my mind.
All right, Professor Helen Tager-Flusberg, Director of the Center for Autism Research and Excellence at Boston University.
Thank you so much.
Thank you so much for your time.
We appreciate it.
Thank you.